And last but not least, we have someone who's national, Martin Sampson, who's CEO of the Canadian Parks and Recreation Association. He's going to finish off our opening session today. He will be providing us live virtual remarks.
Well, thank you for the kind introduction. I'm very, very grateful to the University of Alberta, the Public Health Agency of Canada, and the Housing for Health community and coalition that's gathering around this very, very important topic. And to all of you who are listening right now, I'm just delighted to be able to come in virtually and spend a few moments with you. As mentioned, my name is Martin Sampson. I'm the CEO of the Canadian Parks and Recreation Association. CPRA's mission is to fully realize the role that parks and recreation play in building healthy and vibrant communities. When we say parks, we mean access to our own humanity through access to green space and nature. And when we say recreation, what we mean is all the things that one does to recharge and reset so they can be contributors to the society that we live in. This means that our mission is entirely aligned with what you are doing today, and I commend you for having this conversation. To deliver on our mission, we have 3 areas of focus. The first is that we're a voice on behalf of our sector and our membership, which are the 13 provincial territorial parks and recreation associations and their members, 90% of Canadian municipalities. We're a voice of that sector to the federal government. We convene community across that sector, and then we bring some resources to that sector. Because of our first focus area, I spend a lot of time listening to the national political conversation. And I don't have to tell all of you, we have many, many challenges that we're facing, but I would argue that among the most important is housing. And as we acknowledge and set ourselves to addressing this challenge, I think conversations like the ones that you're having today are extremely important. Now is the time to be thinking about housing for health. Diabetes, heart disease, stroke, cancer, depression, social isolation, all of these things are epidemic. And to build the Canada that we want to leave to our children, we would be very well served to thinking about the cities of our future and how we can design and build and run those cities in a way that is conducive to improving the mental and physical health of all citizens. So I think that the time is now, and I think that this group is going to be playing a leadership role across the country to get us to where we need to be. All of that to say is I commend the more than 200 partners that are engaging on this important topic. Your work is important. I wish I could be there with you. I wish you all of the best of luck on I think this critical issue as we march into our future together. And I thank you very, very much for your time and the opportunity to speak to all of you. Good luck over the next few days.
Thank you so much, Martin. We're very much looking forward to working with you as well for, in the Canadian context to synergize our work both here in Alberta and outside of Alberta. Thank you so much for joining us.
Thank you.